Hello and welcome to my YouTube channel Healthy Panda Official. Today we are going to discuss on the topic piles. Before going to start, I request all of you to like, share, subscribe to get more educational, healthful videos. So let's start the discussion. What is piles? Piles are swellings or swollen hemorrhoids that occur inside and around the anus, and along the anal canal. Hemorrhoids are masses, clumps, cushions of tissue full of blood vessels, support tissue, muscle and elastic fibers in the anal canal. Everyone has hemorrhoids. However, when the hemorrhoids guarding the anal passage become too big due to inflammation, so that the vein walls become stretched, thin, and irritated by passing bowel movements, that is when piles develops. In most cases, piles goes away on its own. Piles can be broadly classified into two categories. Internal piles are located far within the rectum and can't be seen or felt. The only symptom is usually bleeding. Internal piles can be classified into four grades. Grade 1, these are tiny hemorrhoids within the lining of the anus. Grade 2, these hemorrhoids too lie within the anus and are slightly larger than grade 1 hemorrhoids. These hemorrhoids may get pushed out while passing stool but return to the original position on their own. Grade 3, these are also known as prolapsed hemorrhoids. They appear outside the anus. The patient can push them back in by pressing against them with his fingers. Grade 4, these hemorrhoids cannot be pushed back and stay outside the anus at all times. They need to be treated by a doctor who usually suggests a surgery. External piles are located around the anus right under the skin, where there are many pain-sensing nerves. They, therefore, hurt as well as bleed. Anyone at any age can be affected by piles. Though it has been observed that people over 45 years of age usually get affected by piles. About 50% of people experience this condition at some time in their life. Women who are pregnant too experience it. Though it is not clear what causes hemorrhoids, researchers think this might be an inherited condition of weak veins or varicose veins leading to hemorrhoids. How does piles occur? Hemorrhoids are masses, clumps, cushions of tissue full of blood vessels, support tissue, muscle and elastic fibers in the anal canal. Piles are hemorrhoids that have become inflamed. Internal hemorrhoids form when blood vessels inside the rectum become swollen and engorged. External hemorrhoids can occur due to increased pressure caused by obesity, pregnancy, sitting or standing for long hours at a stretch, straining on the toilet, coughing, sneezing, vomiting, and holding your breath while straining to do strenuous physical labor. What are the causes of piles? The primary causes of piles include genetic predisposition to piles, lack of fiber in the diet, inadequate fluid intake, sedentary lifestyle, stress, straining while passing stool, constipation and diarrhea, constant sitting or standing for long hours at a stretch, sitting for long periods of time on the toilet, anal intercourse, pregnancy, constant heavy lifting, being obese, previous surgery of bowel, constriction of intestine following a surgery, spinal cord injury that leads to bladder and rectal dysfunction, dysfunction of the floor of pelvis. What are the symptoms of piles? The symptoms of piles include bright red bleeding from the anus. Blood may streak the bowel movement or the toilet paper. Pain during bowel movements, painful swelling or a lump near the anus, anal itching, mucus discharge from the anus, hard lump around the anus, area around the anus becomes red and sore. What are the complications of piles? The complications of piles include bleeding during bowel movements, anemia, pain during bowel movements. Piles cause complications associated with hygiene, as the anal area becomes difficult to clean after defecation. Poor hygiene around the anal area can lead to several infections, itchiness around the anal area, gangrene. If the blood supply to an internal hemorrhoid is cut off, medical treatment. Piles often clear up on their own but may require treatment or even surgery if the symptoms are severe. The treatment of piles varies for internal and external piles. Grade 1 and 2 of internal hemorrhoids is usually treated with medicine and a planned diet of fibrous, non-spicy food. In some cases, the doctors may also prescribe a topical cream. Grade 3 of internal hemorrhoids is also treated with medicine and a change of diet but may require surgical intervention if the symptoms are severe. Treatment of grade 4 internal piles requires prompt surgical intervention, especially if gangrenous tissue is found. To treat external piles, your doctor might suggest hemorrhoid creams or ice packs to reduce the swelling. If the case is too severe, the doctor may suggest surgery, which can include removal of hemorrhoids using an infrared photo, laser, or electrical coagulation to burn tissue affected by pile. Sclerotherapy to eliminate varicose veins, which could be the cause of piles. Exercising can easily reduce the symptoms of piles. You can go for exercises such as brisk walking, deep breathing exercises, stretching exercises, aerobics, and Kegel exercises 3 times every day. The steps for Kegel exercises are contracting your pelvic muscles. It is akin to the action you do when you hold urination. Squeeze and hold for 3 seconds, then relax for another 3 seconds. Repeat the exercise 10 times each session, until you can do as many as 15 repetitions.